What is a DaTscan for Parkinson's? Have you ever wondered how doctors diagnose Parkinson's disease? One important tool in this process is called a DaTscan. A DaTscan is a specialized brain imaging test that helps healthcare professionals visualize the dopamine system in the brain. This is particularly useful for diagnosing Parkinson's disease. During the procedure, a small amount of a radioactive drug known as ioflupine I-123 is injected into the patient. This drug binds to dopamine transporters, which are proteins that play a crucial role in regulating dopamine uptake in nerve cells responsible for movement control. Once the drug is injected, a machine called a single-photon emission computed tomography scanner, or SPECT scanner, is used to detect how the radioactive tracer is distributed and how active the dopamine transporters are in the brain. In Parkinson's disease, the nerve cells that produce dopamine gradually break down and die. This leads to a decrease in dopamine transporter activity. A DaTscan can reveal this loss by showing reduced uptake of the radioactive tracer in specific areas of the brain, especially in the striatum. Interestingly, for the motor symptoms of Parkinson's to become noticeable, about 50% or more of the dopamine-producing neurons need to be lost. The DaTscan can detect reduced activity even in the early stages of the disease, when symptoms might not be very clear. This makes it a valuable tool in the diagnosis process. The primary clinical use of a DaTscan is to help differentiate Parkinson's disease from other conditions that can cause similar symptoms, such as essential tremor or drug-induced Parkinsonism. If a DaTscan shows reduced dopamine transporter activity, it supports a diagnosis of Parkinson's or related atypical Parkinsonian syndromes, like multiple system atrophy or progressive supranuclear palsy. Conversely, a normal scan suggests that Parkinson's disease is less likely. However, it is important to note that a DaTscan is not a standalone diagnostic tool. It cannot definitively diagnose Parkinson's disease by itself. The results must be interpreted alongside a thorough clinical evaluation by a healthcare professional. Other disorders can also lead to reduced dopamine transporter activity, and sometimes early Parkinson's disease may yield a normal scan. In summary, a DaTscan provides valuable information about dopamine transporter activity in the brain. It aids in diagnosing and differentiating Parkinson's disease from other movement disorders, especially when the clinical diagnosis is uncertain. While it is a helpful tool, it complements rather than replaces the comprehensive medical assessment needed for a Parkinson's diagnosis. Always consult with a healthcare professional for personalized medical advice.